For more than a decade, it was one of America's great scams. It was easy to pull off, it was hard to detect, it didn't require violence, and you can make millions doing it. The sucker in this scam was the US government, as fraudsters took advantage of a blind spot in the Medicare program. The tool of their trade, believe it or not, this. This power wheelchair is meant only for the severely disabled. That means people who cannot walk on their own and who also lack the strength to push a standard wheelchair. Sometime in the 1990s, scammers realized that Medicare was very good about paying for these chairs. Too good, in fact. They discovered that Medicare would usually pay them most of the costs, even if they sent in a bill for a patient who didn't actually need a wheelchair, or if they sent them a bill for a wheelchair that didn't exist at all. All scammers needed to do was follow this simple 4-step procedure. First, find the patients, or at least find the patient's Medicare ID numbers. But why wait for patients to come to you when you can go out and find them? Some scammers bought lists of stolen Medicare ID numbers. Others paid middlemen called cappers to round up patients for them, sometimes for a fee as high as $900 a head. Now that you have your patient, you need to find a doctor who's willing to play ball. After all, you need somebody to certify that a patient needs a wheelchair when in reality they don't. Surprisingly, you can buy a doctor's signature for a few $100 for each prescription. Some fraudsters have even saved that money by stealing the identities of dead doctors and writing the prescriptions themselves. The third step is to choose a piece of medical equipment you think Medicare will pay for. In earlier versions of this scam, fraudsters had submitted bogus bills for orthopedic braces, diabetic supplies, even home electroshock kits. But it turns out that power wheelchairs were the perfect con artist's tool because they were so expensive and the profit margin was so great. Until recently, wheelchairs like this one went for less than $900 wholesale, but Medicare paid about $5,000 for them. That left more than enough money to pay off the doctor, pay off the patient recruiter, and still make a solid profit. Lastly, you send Medicare the bill. And this is where the system becomes very vulnerable. For years, Medicare did not check the paperwork in much detail. They just paid the money, usually within 30 days. When scammers figured that out in the late 1990s, wheelchair claims exploded. Medicare paid just $259 million for power wheelchairs in 1999, but by 2003 it was paying $940 million. The problem is that every day Medicare gets about 4.4 million claims, and it only has the resources to review a tiny fraction of them. Today, authorities have managed to tamp down on the power wheelchair fraud by prosecuting the scammers and giving special scrutiny to claims for wheelchairs. But federal officials say Medicare remains very vulnerable to similar kinds of fraud. It's not that the scammers have stopped scamming, it's that they've moved on from power wheelchairs and found easier means to steal. The newest fad, officials say, is to send in fake bills for prosthetic arms.